I'm probably sharing the wrong screen, aren't I? All right, there we go. Okay, welcome everybody. I hope you all enjoyed that breakout sessions that we had. This is really our only way that we can network with the virtual platform that we're on right now. Again, I want to remind everybody that on the chat, which if you put your mouse at the bottom of the screen, you'll see the chat pop up. To put your contact information there so that you can communicate with the people you met with later on at the end of the meeting. The little three dot button that's in where you put your information, you can click on that and save the chat. So we'll start with our association. Our website is thedollar.com, and on that website we've got some key links. If you're in Colorado, this will be important to you. The places you want to take a look at on those key links is going to be the new regulations. This is actually not new anymore because they were written about 2 years ago, but you need to know this chapter 7 like the back of your hand. These are all the regulations that you have to follow for the assisted living. And we still have some people coming in, so I'm getting a little distracted here. Next is the RALNetCon, which is over, so never mind that one. This was from last month. It was a very good conference. There was a ton of information there. One of our guests, Michelle, was actually a speaker, and she put on a great presentation. And her husband, Brian, I'll talk about in just a minute here. Also, we have the Facebook page, and we encourage everybody to join the Facebook group. And this is a place to communicate with everybody on the social level. We've seen people look for employees out of this, look for advice out of this, advertise empty beds. So it's a good platform, and we encourage your participation. That is Denver ALR on Facebook. And then, of course, there's the meetup group. This is where we do our RSVPs, which is more helpful when we actually have a room that we're leasing or having to let the restaurant know how many people that they need to be taken care of. But we appreciate everybody to sign up on this, and we also use it for communication as well. And now I'm going to go through our sponsors real quick. So we've got half a dozen sponsors here. First one is the RIL National Association. And Brian Pinkowski here is, we're very fortunate to have him and his wife as part of our group. They are involved in the national group, and Brian happens to be the president of the National Association. Brian, would you like to say a few words?
Well, I'm just happy to see everybody here. I know we're all going through this COVID character test, as I like to call it. Yes, we're being challenged in many new ways, but I think the underlying spirit of man to find ways to socialize and interact together and move things forward in a positive direction, that's still actually going strong. And I think we're getting more creative with these new barriers about how to do that.
Thanks, Brian. So if you are a member of Denver ALR, you do get a free associate level membership with the RIL National Association. There's a free newsletter that gets passed out, access to the group purchasing benefits, and that's pretty big. They're adding a lot of things to that. You get half off the full RALNet membership, and if you are a full member, then you get half off or you get $149 credited toward your conference ticket. And sometimes, depending on when you buy that conference ticket, that can be half of the ticket. We also have, as one of our sponsors, the Anderson Legal and Business and Tax Advisors. These guys are the guys that are really good at helping you with your taxes, pay less, and setting up your business entities. So we highly recommend them for that. And they're at http://andersonadvisors.com. We have the RIL Academy. If you're new to this space, and this is a great place to go for education. So that's oh, I should have their website on there, but it's ralacademy.com. We also have assisted living marketing, and these guys built our website for Denver Association of Assisted Living Residences. And Peter is here. Peter, would you like to say a couple words?
Yeah, real quick, guys. Great to be here and see you all. And yeah, if you have questions or need help with anything, marketing of your communities, let me know. I was talking to someone earlier. They wanted to get Google Analytics set up on their site. And she's like, how much do you charge per hour? It's like, you know what? Honestly, take me like 5 minutes. So just let me set it up for you and we'll call it a favor. So if, you got something small like that, just reach out and be glad to help you with that.
Peter's been great to work with. He's extremely responsive whenever we need something. He's always right there getting it taken care of. And we don't typically see that from our web guys. So next we have Brian and Michelle Pinkowski. And who would like to take this? Michelle or Brian? Probably.
Sure, I'll take
Michelle
it.
speaks for us.
Okay.
Okay, all right. So, well, everybody knows us, I think. It's just great to see everybody. I think, we provide legal services for all the ALR needs, from business formation and zoning and FDI related things and licensing and all that stuff. And it's just been our pleasure over the last couple of years to be working with you all and seeing all the good things that you're doing.
Thanks, Michelle. And I have to say that, we're very, very fortunate to have these two in our group. When we went through the regulation changes 2 years ago, they were instrumental in making sure that these weren't damaging to the small assisted living homes, and we're forever in their debt for all of the work that they put into that. Thank you, Michelle.
Thanks, Vern, and we appreciate you.
Next, we have A Better Way Realty. That is the company that I work with, and we do lease options. And so we'll help you buy that house and actually lease it back to you. And you have an option to buy it from us down the road. And I also broker these businesses. So if you are thinking of buying or selling, then I'd be happy to help you out with that process. I have done 22 of these deals in the last 3 years. And we have funded, we funded 22 of these through ABW, not all 22 that I did, because some of those were cash deals, but we currently own 22 homes and we're looking to build more. We're actually sitting on a big pile of cash right now, so we're looking for some ways to deploy it. So if anybody has an existing business, assisted living, and you're looking to expand, then we'd love to help you out with something like that. If you're new, looking to get into this business, we'd certainly like to help you find one and buy that. We're looking for some bigger deals too. If you're looking to get into a larger facility, we've got, like I said, we have a lot of cash right now that we need to deploy. So my job is to help my boss spend it. That's a good job.
I want that job.
All right, next I'm going to turn this over to Jeff Reynolds. And Jeff comes here from the CALA. That's another organization similar to us. They deal with assisted living homes like we do. And so if you have an existing home, you should consider joining their group as well. They have a lot of information, and they work pretty hard with the legislature to do the help with the laws. Jeff has been on their board for several years, and I asked him to come and talk to us about what's been going on with these the regulation changes and how they're going to affect the small facilities here. So Jeff, if you'd like to share your screen, and you can take it over.
Yeah, be happy to. Hang on a second here. Well, where'd we go? Bear with me, folks. Did I get it?
Not yet.
Okay, let me take another run at it. I've got a few things up here, so that must be where I missed. There we go. Well, I'm going to close a couple things down here and see if I can get it to come up that way.
Okay,
My apologies.
no problem.
Bear with me here.
All this technology is kind of new to all of us.
Yeah, I thought I had
A
it
year ago.
here, but training. Oh, there it is. It was hidden. How about that?
Looking good, Jeff.
All right, all right, all right. That's my Matthew McConaughey intro. It is good to be with you all. Are you getting the full screen there? There it is.
Looks good.
Okay. Well, thank you all for taking some time with me this evening. And just a little bit of background for you all. I started in the small ALF business. I've got two little homes in Colorado Springs. Got started in 2013, and sometime around 2018, I heard that there were some new regulations coming out, and I didn't know what I didn't know. I still had a tremendous amount to learn at that point, and still do. And I'm not even sure I was a member of CALA yet. But I got the name, somebody gave me the name Vern Harris, and I called him and I said, do you know anything about these? And he talked me through some of it. And I think he may have even pointed me to CALA at some point. It's kind of a blur now, but just want to say thank you to Vern and his involvement and all that he's done to pull us all together in this way. He is more involved in many ways and is an advocate in many ways than a lot of the facility owners that I know. So thank you so much, Vern, for everything you've done and for this opportunity to spend some time with you folks. It feels like coming home again to be back with you guys. So we, in 2018, I shouldn't say we, in 2018, just before or as I was coming on board with CALA or on the CALA board, a Senate resolution was introduced to the legislature. The regulations were well underway and had essentially been written and were headed for concrete. And some good folks at Colorado Assisted Living Association stepped in and got a resolution together and got that fed into the state legislature. And that resolution was approved unanimously. And it was cutting it a little close, but the document was sent with the regs to the Board of Health. And the Board of Health took that and said, we're going to wait until you all, that's CDPHE, the health department, go back to the smalls and get more input and ask more questions. So great thanks to the folks at CALA that were involved in that process. Shortly after that, and I hope it's okay with you all if I take a minute to digress here and give you a little background of what we've done and where we're headed. So shortly after that, the department, the health facilities department, created what they called the ALR work group. the small facility work group. And I applied for that and was accepted. And the other members of that group were Lyle Campbell, Janelle Molina, Tracy Nickel, and Rachel Robertson. These are all small owners of small facilities, kind of spread around Colorado. And I had just a tremendous opportunity to get to know these folks over the following couple of years, and work with the folks at CDPHE. The players for CDPHE that we met with over that couple of years were Elaine McManus. She is the, there we go, now I can see. She's the Health Facilities Assistant Chief of Staff. She's Randy Kuykendall's right-hand gal now. Dee Rita, ALR Section Manager. Francine Berquist, she's the Policy Analyst for CDPHE. And Cheryl McMahon, I don't know if any of you know her. She's a little bit new to the Health Facilities Department, but she is now Health Facilities Branch Chief. And so the lineup is Dee Rita, and then that goes up to Cheryl, and then that goes up to Elaine, and then Elaine goes up to Randy. So that's the chain of command. These are the 5 major sections we covered. What I shared with Vern was, I'm afraid I don't have all of the detail of all of these sections to be able to share with you tonight. And I think even if I did, it would probably take more time than what we've got here. I also mentioned to Vern that I probably need to get back with my peers at CALA and get together. It occurred to me tonight that it would probably be helpful to get some kind of a Delta document, a document that shows what specific changes have been made to all of the regulations that were changed. And I don't have that detail for you tonight, but I think I've got at least the broad areas that you can begin to take a look at in your homes. Those of you who are investors, I think you probably would be investors or builders or looking to buy a small facility or buy a home and convert a small facility to assisted living. I think this last bullet is probably going to be of quite a bit of interest to you, and that's the Facility Guidelines Institute. It's a little scary for me to think I'll be presenting on something that Michelle Pinkowski is really the expert on, not me, but I can share with you what I know and what I learned and what I saw. And certainly Michelle can jump in and give her thoughts as well if she'd like to do that. The list here that you all see is a list of all the meetings that we had with the ALR group. We covered about 35 meetings. Well, it's exactly 35 meetings. From September 4th, that was our kickoff meeting. The last one was January 23rd. And we made basically our final proposal there to the ALEC committee, and they gave their response, and then COVID hit. So there has been some work done on this since then, but it certainly slowed them down, slowed us down. But I would say that we've presented all that we're going to present to them at this point until the Board of Health meeting. And I think I've got this at the end. You all might want to jot this down. It's December the official date hasn't been published, but the Board of Health meeting to cover all of the work that we did and the new regulations is the 3rd week in December. I'm just looking that up for you all here. And it's usually on a Wednesday. So the official date has not been published. but it looks like it's going to be the 16th. I guess I'd recommend that y'all just double check. As soon as I could get it, the official date, I can certainly send that to Vern and he can send it to you all. I've got my contact information at the end of this, and I can, if you want to contact me and have me give you that date, I can certainly do that. I think the point of my slide here is of course, it's very small. I don't know if you can even see it, but where I'm going with this is that we, between the 4 or 5 of us, we invested somewhere in the neighborhood of about 1,000 hours on a line-by-line analysis of all of those areas that I just showed you. We made our proposal to CDPHE, and unfortunately, what we got was in the way of change was fairly cosmetic. There were a few changes, but we didn't get the ones we wanted. I think the good side of the process was that we were able to make a connection with CDPHE that hasn't been done in quite some time. We were able to hear their stories. They were able to hear ours. And so I think there was a good relationship building there. But the bottom line is our conclusion is that we simply did not get what we need. And I'd say that that's true for all facilities, but it's for the smalls in particular that we've got some great concern about. Now, with that said, I'll take a minute here just to go through the 5 areas that we covered and at least just hit the highlights for you all, and then talk a little bit more about our plans going forward. So briefly on the administrator requirements, the major changes there from what we've seen are a competency exam that you actually have to take a test and you have to pass. When I got my administrator certification, I sat through a class and it was done in 2 days and there was no test and off you go. Now you must take a test, you must pass it. I think it's, I don't know, 80, 85% you're required to get to. There is also a requirement for administrators to be Q-mapped. That's for beds, facilities that are 19 beds or less. We thought that probably made some pretty good sense, just in terms of the small facilities. We thought that was probably reasonable. For those of you who don't know it, there was a proposal put on the table by CDPHE early in the process that only nurses could be owners or administrators of small facilities. Those of you who don't know Eileen Doherty, she is one of the best kept secrets in the state of Colorado in terms of advocacy for the smalls. She put a group of people together and got those folks to show up at the hearing on this idea of nurses only for small facility ownership, and got that shut down post haste. So if you've never met her, you get a chance to meet her, tell her thank you. And if you do know her, tell her thanks. She's done a lot of work on behalf of the smalls of Colorado, and she's on our board now. She's just been a great, and continues to be a really important asset for CALA. Secure environments. As most of you know, the small secured facilities that are also Medicaid are becoming fewer and further in between. That's probably another discussion for another day. But for those of you who aren't aware of it, effective January 1, and really this has been in effect this year, those of you who have secured facilities will need to have wake staff if you haven't already. For those of you that have not been using wake staff, you probably are already aware of this, but you're looking at somewhere in the neighborhood of a 30 or 40% increase in your labor. This was one that we fought hard, and as far as we can tell, got a continued no on that side. And we'll come back to that here in a couple of minutes. For the non-secured, there was some movement to try to require wake staff for non-secured. Luckily, the folks at CDPHE did come to their senses and decide that instead a one-time check between 10 p.m. and 6 a.m. Would be acceptable. I'm thinking of a couple of my friends and peers who do have wake staff at night. I want to be sure and clarify here that our position on this is not that wake staff is wrong or bad. Certainly, that does provide more safety for our residents. Our position is that there should be choice and that it shouldn't be up to the state of Colorado to make that decision. So I want to be sure I'm not misspeaking here on our view of wake staff. I think for those of you who do it, who have it, it's a good thing, and keep on doing it. Personnel and staff training. This was the other area that we drilled into. Staff are now expected to be trained on policies and procedures, occurrence reporting, redirecting and managing of behaviors of residents, effective communication with residents with hearing loss, dementia, limited ability to speak English, a comprehensive fall and lift assistance program, and person-centered care. We'll jump back real quick here to policies and procedures and occurrence reporting. We did get the state to reword that in such a way that our staff are not expected to know, or I should say memorize, or have a full understanding of the policies and procedures. Our stance on that was that that's our job. As owners, administrators, that's for us. We don't need to be adding that to our staff. Same with occurrence reporting. We don't want staff in the occurrence reporting system and fooling around in there. So we got the wording for that to be changed to simply say that they have to have an understanding of it, that they can go where they need to go or know where they need to go to get to the policies and procedures. Comprehensive fall and lift assistance program. All of you I know probably already have fall and lift procedures in your policies. This is one that's just, it's going to be a little more broad. I'll be honest with you, we're still waiting for some clarification on that as well. As soon as we get the specifics on that, I'm certain that I can get that over to Vern or post it somewhere. Person-centered care. I'm going to mention this one. I'm going to slow down here for a second to see if there's any questions, and then we can go on. Person-centered care. So this is one that, how do I say this? Well, what you're seeing here is a definition that frankly, I pulled from the internet. I've not seen one from CDPHE yet. It might be out there by now. I've been using this for my staff. To their credit, and forgive me if this sounds just a little bit jaded, but to their credit, even one of the higher ups at CDPHE has admitted that this is really a buzzword. Now that said, there are some really niceties that come from this, but for those of us as owners, those of us who have to live through a survey and deal with the tags that come along, we have a hard time seeing this as nothing more than just another way for us to be cited. So I don't mean this in a narrow way. I think it's, I think there's some good things that can come from this. And it's one that gets used now by the state of Colorado. as a talking point for just about everything they do. So far, the training I've done on it is what you've seen, is what you see here.
Yeah.
It's simply this statement and then discussion with my staff about what do they believe person-centered care means. We have somebody on our board at CALA, Nicole Chivone, who is very close to the person-centered care process and has done a lot of work with that, worked with some of the government entities on that definition. I can certainly get her definition to you. I tried to get it before this presentation, but I haven't heard back from her. I can certainly get that from her and get it over to you all
Jeff,
if you'd like to see it.
Jeff, can I comment on that?
Yeah, absolutely. Please.
I've got about 5 years of background on person-centered care.
Yep.
I've got volumes of documents on person-centered care. This came from the federal government for Medicaid facilities. So there are some definite definitions and descriptions of what the expectation is on person-centered care. But even with all the volumes of information I have, it's still like anything else is interpretive. And the health department didn't come up with anything on their own here. They just decided to latch on to the federal directive for Medicaid facilities.
Yep.
And because it is such a vague definition in a lot of ways, the federal definition does have a lot of specifics, but the problem is the way it's written federally and the specifics on federal are just almost impossible. I mean, they're just almost impossible, especially in a small environment because, you know, in a memory care facility, every resident has to have a key to the front door. And and egress out the doors. It's just, there's just stuff that's just completely unrealistic.
Yep.
And to be honest with you, my whole thing, and I'm Medicaid, so I've been dealing with it for about 4 or 5 years now. And I got so frustrated with trying to sort it out and that the state won't give you any direction on it. I just decided, you know what? When they cite me, I'll deal with it.
Did everybody hear what Dennis just said? I know that's a silly question, but did everyone hear that? And I'm so glad. I so appreciate his candor and his willingness to share that openly. Our trouble with CDPHE, and if we have some of my friends from CDPHE on the call, I want you to feel welcome to join, jump right in and give your thoughts. But the trouble that we've had over these last 2 years is we meet with them behind the scenes and in good faith try to help, try to understand, listen, and learn. And somehow that doesn't seem to get imparted to the surveyors. In other words, we have, Vern, I don't know how much latitude I'm permitted to say here, and I'll try to keep my emotion out of it, but we have a leadership at CDPHE, some of who are well-intentioned, some of whom have a good idea, but it never seems to come out that way during a survey. What we were told multiple times was, don't worry about that. You won't be cited for that. That's not the intent of this. But somehow the surveyors don't seem to get that picture. So part of what and forgive me, Dennis, if I'm trailing too much here, but some of what we're beginning to work on is a database at CALA for anyone to, I've already spoken with Pete Brissett about this, to go in and report their results from a survey and start to get some documentation of the inconsistencies. And I think probably person-centered care is going to be right in the middle of that. Thank you. Dennis.
I'll cover for you, Jeff, and I'll throw the emotion and the honesty into that. You know, one of my issues with CDPHE is that in their minds they are never wrong, and I've had situations where I've been cited in a survey, made the changes they directed me to make, and then were cited in my very next survey for doing it the way they told me to do it.
Yes, sir.
So, and I have spoken to Dee and the whole group up there numerous times about this, and they tell us, you know, their answer is always the same. That never happens. Or we train all of our surveyors. They're all working off the same document. Well, that's just not true. I mean, that's just not true. And this thing that Jeff is talking about, I think, is critical to making a statement in the future. We have to be willing to put, you know, listen, we're all doing the best we can and we're all going to get cited for something. So you can't approach us like I'm embarrassed. I don't want to post what I got cited for. Post what you got cited for. Let us help figure out the best way to respond to it so we're all responding consistently. And then eventually we'll have a database that will have more power than they have. Because at the end of the day, the one thing that everybody has to remember, the reason, and anybody who's had a survey recently, you know it's almost impossible to get your responses through that stupid committee they have. And the reason that they're making this so hard is because when you do have an incident of some sort, they're going to go back through your entire history and find a reason to fine you, take you to court, revoke your license, any number of things. And the other thing I'll caveat this by, don't ever forget that in their minds, it costs just as much money to survey an 8-bed facility as it does a 100-bed facility. They have no interest in having 8-bed facilities in their on their docket because it's too costly for them. So, you know, you have no friends up there. And this database could put all of us in a much better position because we'd all be responding uniformly. And as far as the process that Jeff is talking about, for all the work, and I respect all the time and work that committee put into that, at the end of the day, all those people from CDPHE did was go behind those damn glass doors where the elevators are, go up to the 5th floor, which is where all their officers are, and then they decided what they were going to do. You know, you couldn't convince me that they took any of the feedback seriously.
How am I, Vern, how are we doing on time?
Sorry, I had to find my unmute. We're doing okay. You know, this is good stuff. You guys just keep on feeding the information.
As you all can see, Dennis and I are somewhat in the same. I've never met Dennis, but we're somewhat in the same in that we tend to put some emotion behind it. Those of you who are owners of small facilities, I think there's probably at least a few of you that even if you're not expressing it, you can feel it and you've lived through it. So I think we need to have Dennis become our new spokesperson for CALA. Thank you for those words. And we do need to come back to what we just shared here, because as much as I would like to have had our 2 years with them be the resolving process to have solved the problem, it didn't, and it didn't come close. What it did do is build us, I think, for Dennis and for those of you, others of you who are small facility owners, I think what it did do for us is bought us the right to say, we have tried, we made our best attempt, we went to them in good faith to try to work through this, and what we got was a pretty clear no. So I can't imagine that there is you all know that the state legislature, I wasn't planning to get into this right away, but you all, I'm sure you all are most of you or many of you are aware that starting next year, Jan 7, we'll have legislature on the House side that is 100% turnover. And then on the Senate side is 50% turnover. So our plan, we just made this decision in the last couple of days. We need a little more time to get our documents together.
Hey, what's up? Sorry, I was playing it.
For the legislature, but our plan is so we missed it for this year, but it's our plan to become very close, do some lobbying, do whatever we have to do to get that document fed through. And we can talk about what that document is at the end of this call if you want to, but to get that document fed into the Colorado State Legislature for the 2022 session that's coming up.
Jeff, Tamara wants to chime in on this.
Oh, good.
Sorry, Jeff, I couldn't keep quiet anymore.
Good.
So just with that topic that you just brought up, we recently had some information that there are a couple legislators that have reached out to us who want to help us with kind of moving things forward. So that particular idea may not be on the back burner if we can get some face time with these guys. So, so just like that.
Does everyone know Tamara? Tamara is, I've got the privilege of being able to serve with her on the CALA board. She's kind of new to us, but she is when it comes to advocacy, she's a heavy hitter. And Tamara's right. I did see a couple emails come through today that said something to the effect of, hey, wait a minute, are we sure we can't get this done for 21? So I may have spoken too soon. What I'd like for y'all to know is that we cannot, as the Smalls of Colorado, we simply cannot stand by and watch what's getting ready to unfold effective January 1 from CDPHE. I'm on a bit of a tirade here, but I'm gonna stay with this for just 2 more minutes and then I'll move on. For those of you who attended the last ALEC meeting, who either saw it or heard it, I wasn't there, but I got a couple of reports back, and here's what we heard. Starting January 1, this is the words of one of the supervising surveyors there. Starting January 1, first of all, COVID or no COVID, we're coming into your houses 2 at a time. We are going to survey, and we may be there for up to 2 days at a time. When that supervisor was asked, well, can you give us some ideas of what areas maybe we should focus on? Her response was, all of them, and you better know them inside out. Now, folks, I'm not a preacher, but I do have a quite strong opinion about how a health department can and should work hand in hand with those that they supervise or those that they inspect. And for me personally, that kind of comment doesn't get it. So I think if there's anything that I could have you all take away from this presentation, it is this, that we must begin to band together. CALA is in the process of a significant reorganization. Tamara has helped with that tremendously. We're going by this time, end of next week, we'll have an entirely new leadership structure. And we're going to be deploying a a new, I don't know what we call it, Tamara, fee structure that makes it easy for anyone to join. The point is not to sell folks on CALA. The point is to have you all thinking about joining something. Being part of Vern's group here is outstanding, because quite honestly, I'm going to ask Vern for all your names, and we want to have you join us, even if it's signing a signature document that says you approve of the legislation that we're going to put forward. I think what you really need to hear, I hope what you hear in this, is that if you haven't joined something, now is the time. Tamara?
Let me just, a couple of comments on that. First of all, I have been in and out of CALA for years, mostly out because of my incredible frustration with their lack of performance. I am thrilled, and Tamara, I need to reach out to you because I've still not been able to renew my membership on that website. I don't know what the block is, but anyway, I'm thrilled with the direction of CALA, and I agree with Jeff that we need to start showing a lot more force. Second of all, you know, anybody that knows me knows that one of my bedrocks is if you get paid with my tax dollars, you don't get to tell me how life is going to be. You just don't get to. Your paycheck comes from me. And the problem with CDPHE, and I'm going to ask in private for Jeff, supervisor was, because that person needs to go, period, plain and simple. And the reason that person exists is because nobody has taken them to court. And believe me, I'm prepared to go to court when they pull a stunt like that on me. I fully intend to get in their face and let a judge decide. Whenever they cite me, I make them, and I know that they do this, but I make them tell me exactly what they're citing me for, the number of the regulation, and how they're interpreting it. Because their job is to enforce those regulations, not to interpret them. And whenever we're in disagreement, I just tell them, you know what? You have your opinion and I have mine, and I think it's time for a judge to tell us what his is.
And if
they take their stand because nobody stands against them.
Yes, and what Dennis just said, something tremendous for those of you, for the other 40 of you here looking on, Dennis has shared something tremendously poignant. The folks at the Department of Health have known for some time that we have been splintered, that we've been back on our heels, and that we're not gathered. They've known that, and they've been able to take advantage of that. What Dennis also shared about CALA and its past, over the past 4 or 5 years, also true. It has been for some time in need of some significant house cleaning. And it would take too long to describe what Tamara and I have been through, but I can share with you all that over about the last 120 days, we're a different organization. And when it comes to CDPHE, we mean business. So what I want you to know is it's important, whether you join CALA or some other group, it's important that you join something. Brian, and I know I'm preaching here, forgive me, Vern, I'm preaching a little bit here. Just if you can just bear with me.
Yeah, Jeff, and then I know Brian wants to say something to us as well.
Well, and I was just going to mention Brian and Michelle Pinkowski. You already know this. I can't believe it's taken me this long. I just met Brian a few weeks ago, and I went back to the board and I said, why haven't we been in touch with this man? Where have we been? He has, I don't know a lot about his association yet, but I know about my conversation with him. He's another one that you all could join. He is of the same mindset. He's just been waiting, I think, as many of us have, for the right opportunity to pounce. Go ahead, Brian.
Yeah, sure. Let me speak with two hats. First, as a lawyer with Pinkowski Law here in Colorado, we work with many of the people who are on this call, and increasingly what we're seeing throughout Colorado is that people are willing to push back against, starting with surveys. They're legally willing to push back. So some of what Dennis is talking about is beginning to take place. So that's a good thing, because they like their, I like to call it the imaginary dispute resolution process, the IDR process. They like that, but that doesn't usually provide a real satisfactory result by all reports. But by also other reports, we know that they don't like to actually end up before the administrative judge. So if more owners are willing to push back on some of these surveys, then there's an opportunity for corrective action to take place. And secondly, we're really excited about what CALA is doing, how it's kind of getting focused. We like the collaboration that we're seeing between CALA and Vern's group. It's all one group with slightly different angles on what's going on. So it's really good to hear that CALA's going to get a little bit more focused on hardcore protection of the smaller facilities, because they're really, really important for choice throughout Colorado. And then last, let me switch hats to being the president of the Residential Assisted Living National Association. Anybody who's a member of Vern's group is automatically a member of the National Association. And so and that could be the same situation with CALA here in the near future. We'll be talking with you guys about that. And that would allow some additional advocacy support, even in the form of a letter that just says, hey, all that stuff that CALA said, we got 43,000 members who agree with exactly that. So we could take that kind of position to kind of add some emphasis to what you're saying. And then fourth, you talked about a draft bill. There's a lot of other things that can also be done in addition to a draft bill. One of those is you could start, all the stuff that's being said here could be an open letter to Governor Polis and whoever the current head of the health department is in the Denver Post, saying, hey, we got some inconsistencies here and you need to get on board with this, what do they call it? The REACH program? That's another imaginary program. The REACH program, because there's no collaboration. Yeah. It's just a punishment, along with open statements that have been made by a number of senior health department officials about how they feel about the small facilities. So how to couch that letter is a careful thing to do, but you could begin to push back in other ways, because a bill would be great if it gets through. It would be better if the ground had been worked before the bill showed up at legislators, so that the legislators had some idea that there were some people unhappy about it. There's a number of things that could be talked about to move forward on that. And that's my list for right now.
Just one comment, Brian. Can I just say something quick, Jeff?
Yeah.
With joining together, now I kind of forgot my train of thought because I was reading in the chat. I'll think about it and I'll come back in. Sorry.
That's okay. That's okay.
All right, Jeff, I'm going to try to move us forward a little bit on this. I know we got a little bit digressed a little bit, but it almost sounds like we might want to have a meeting just on this topic, because there's obviously a lot of interest here, and it might be something that we look at maybe at our next meeting or down the road.
I do apologize, Vern. But I apologize. Such good. Can you all see me on your screens?
Yes.
I've had this gigantic smile on my face just to hear all of these voices and input. Vern, do we have time for just one more from Tamara, and then I'll quickly wrap this up?
I just wanted to mention, as Brian was talking about the imaginary dispute resolution as a committee at CDPHE and also the Assisted Living Advisory Council, they were accepting applications to be on those committees. I was on the ALAC committee for the last 2 years, only because Randy Kirkendall doesn't like me and wanted to keep an eye on me. I did reapply. I also applied for the IDR committee. I think that for any of you who have a little bit of time, my understanding is that they're taking more applications, even though the application period has ended, but I think they're looking for alternates. And so applying to, sending an email to Dee Rita or Cheryl or Elaine would be a good thing for you to do. Somebody from this group, it would be really good to have some representation. And because you are large, Brian, we talked about this, even with Ralna, because you're well represented in the industry, it would be a good time to demand a seat at the table. And that's it.
Love to see Brian at the ALEC table. That would be fabulous. Brian's shaking his head. Okay, here we go. FGI. I swear I'm coming to the end here, Vern. Thank you all for your patience. I appreciate this. So the final piece of what we covered was the Facility Guidelines Institute. These are now essentially a new building code that is, in the words of CDPHE, based on and has been brought forth because of their need to fulfill person-centered care for our buildings. Very quickly here, here are the concessions, and I don't know if Michelle's still on the line, but I'm about 95% certain it's because of her that we got the concessions you can see here. Attached bathroom, hang on, I gotta minimize this. Attached, a bathroom with shower attached to every bedroom. Parking space for every resident. A gurney-capable elevator for any home with more than one story. That would have meant, for both of my little places are both, ranch style, but have, 2 stories. I would have been required to put in a gurney-capable elevator. And I believe it was Michelle that got in there and said, nope, that doesn't work. So thank you to her for that. Now, here's the difficulty. I'm having trouble seeing, there we go. The difficulty there, y'all, is that those are the only concessions that CDPHE gave. Those are the only concessions they gave us. And I know we're stressed for time here, but I'm going to quickly move through this. Out of the 50 states in the United States, now I'll let Michelle correct me if I'm missing something here. This information is it's nearly a year old, so it could be different now. But out of the 50 states, 43 have adopted FGI. Of those 43, only 12 have adopted it for assisted living. That's 12 states out of 50 who have adopted FGI for assisted living. I got this off of the FGI website. Of those 12, 5 have adopted FGI for facilities that are small, under their definition of small. That's Delaware, Montana, Nebraska, Utah, and us. And out of those 5, we are the only state in the entire U.S. that applies all but those 3 or 4 concessions you just saw to the smalls. That means that Colorado has made a conscious decision to apply FGI more vehemently towards the smalls than any other state in the U.S. Now, for the rest of you, for those of you who are thinking of converting your garage to bedrooms, that's what I'm in the process of right now. Or maybe you want to add a bathroom or anything that requires moving a wall, I guess I would say. you will be required, your entire facility, and here we go, Michelle, you can correct me if I'm missing something here, but your entire facility would have to be retrofitted to comply with FGI. I fed just with very good intentions. Elaine and I actually worked on this together. Elaine McManus. I fed my garage conversion plans through the FGI review process. If Vern decides that there's time to get into those details, I can certainly do that. But I'll share with you that had I was grandfathered, but had my garage conversion been subject to, had I had to comply with FGI, my little garage conversion would have been stopped. If CDPHE had chosen to exercise FGI all the way to the end. So that's, we've already covered this. As I've shared with you all, it's tremendously important to get involved in some way. Tamara and I we're with CALA. That's kind of our home right now, but we have moved away from this idea of competing with other associations. We simply aren't going to do that anymore. And so what I'm trying to say is get involved somewhere and let's come together. We need a large group to come together and make this happen. Tamara and I met with the folks at GDPRA this week. They are a fabulous group. They've got some good things going on. I'll be connecting with Brian next week. And Vern has been so gracious to let us join this tonight and just talk to you all. And keep in mind that it's not necessarily about what stable you're in, but just being able to get out on the field with us. That's what I'll say. This is my contact information. Remember, the Board of Health meeting is I'm pretty sure the 16th. Any of you have questions, you want to know how to get involved, specifics on the regulations, I will get to work on a document for you all that has more specific information, and you can send me an email or give me a call if you'd like to get that.
Where's that Board of Health meeting going to be held?
It's a Zoom. And Tamara, do you know?
There's some, I sent out an email to Vern and he'll blast it out to everybody. I just got the packet that CDPHE presented to the Board of Health for review to ask for the hearing. They talked about it on the 22nd of October about having the hearing. They haven't exactly assigned it yet. There was a couple of questions to a couple of the areas on the regulations, like one section on the administrator requirements, the section H doesn't say that you have to have an education and healthcare experience within the last 10 years, like everything else says within the last 10 years. There's a couple little things they were trying to tweak. But I talked with Eileen today for a considerable amount of time, and we're suspecting that that's not going to hold it up, that it's still going to be happening in December. And they said once it gets heard, it's like a 60-day process. So at the latest, the third Wednesday in January, but we're expecting the 16th, and there'll be a link to that because there'll be public comment allowed. And we'll send out a blast so that people can write into the Board of Health members. If we get this legislation connection going that we're hoping to this week, we'll start blasting out letters to the legislature too and kind of direct some noise.
It might be helpful, Tamara, to even have a sample letter or two that the group could send out.
I have some from 2 years ago. I can send them out.
Okay.
Yeah.
That, you know, a lot of times when we're asked to write to our legislature, well, what should we be saying?
Yeah, we'll send you a bunch of stuff. There's a lot of us passionate on the new CALA board that we're trying to get people to help us because, you know, the more we have, the more we can accomplish. Yeah, we're trying to expand that committee. So anybody interested, we'd love to have your help.
Vern, are these slides going to be available on your site?
Yes, we're going to go ahead and, Jeff, I'm assuming you'll share the slides with us.
Whatever
I
you
have-
want.
Terrific. And I will also share the recording on the website, and I will share the link that Tamara sent me on the website, but I'll also blast that out to the group so that, and Tamara, if you have a few sample letters, I'll include that in the blast so that, you know, we can get a lot of people involved in this.
Mhm.
Quick on this, Vern, if I may. Michelle, I don't know if you're still on this call, but I want you to know that I know you're the expert on FGI, and if I misspoke on something, please do let me know, and we can get that correction out where we need to.
And is there any possibilities where we can have these meetings, like sometimes, like, you know, 2 weeks, in 2 weeks or something?
Yeah, go ahead. Is that for me or Vern? I don't.
Well, which meeting are you speaking of specifically, Fran?
This specific meeting that we have, like, I kind of feel that, like, I'm still unclear on so many things, and I'm being left out as being a new owner.
Gotcha.
So I don't know. I mean, I just thought that maybe it would help if we have one more meeting before your other meeting or something. Yeah.
Well, I'm a little torn in November what to do because our typical day would be the day before Thanksgiving, and usually we skip Christmas, December, because it falls close to December. So I was contemplating skipping November, and this year the last Wednesday falls between Christmas and New Year's. But if you guys wanted to, instead of doing that, if you wanted to have a meeting the third week of November, we could do that instead, and then take a break over the Christmas holiday. So any thoughts or feedback on that?
Maybe we
I'm
could,
in.
maybe we could join up on a meeting together, Vern, with Kala and this group and try to do something, maybe not right before Thanksgiving, but maybe we could come up with some type of an educational thing, and then just a forum because by then we're going to have a lot more information on some of the other things that we've talked about tonight.
I think that's a terrific idea.
Would that be helpful to the folks on the call here?
I see Fran nodding, so I'm thinking that's
Yeah.
we have a thumbs up from Becky. So I think you guys know how to do your thumbs up on the little reactions down at the bottom?
I haven't learned that. Oh, there it is.
Where do you find that at?
All right. So we're seeing a lot of thumbs up. If it's down at the bottom, you know, where you bring your mouse down and
Oh,
first
I
screen,
see.
and off to
Uh-huh.
the right is reactions.
Okay.
Okay, we see lots
Hey,
of thumbs
hey.
up and some applause too.
Can I make a quick suggestion, Vern and Tamara
Yes.
and Jeff? And
Hi, Michelle.
thank you all first for everything that you're doing and all the time that you've been spending. You're amazing. Thank you very much. As you're putting comments together, I think I would suggest that you be as specific as possible in the effects on your homes or the small industry. If you can quantify it in any way,
Yeah.
so that it's not generalized, I don't want to say complaints, because I'm not invalidating them.
No.
It's not generalized statements, but it's more specific. The more specific and the more outcome specific it can be, the better. And we might want to have some more discussions about FGI, just to clear up some things and really find out what it is and how it's affecting people. Because I think we got the biggest, scariest things handled. Now, as I've said a couple times, I'm not an architect, so we need some people with more technical expertise to go through the FGI guidelines and find if there are specific areas that are still causing problems. We need to identify them, because just, you know, saying we don't like FGI as an industry, it's not going to be persuasive. Colorado is devoted now to FGI. We have FGI. But the FGI is just like any building code, and it goes through a revision process. It's in that revision process right now for 2022. So I've helped to make some changes to that. we won't be able to really make any other changes after that. But we need to dig deeper is what I'm saying. We need to really get in there. And if we could get some architects to help us out or some engineers, that would be very helpful. But I think the things that you're experiencing now as you go in for your plan review for FGI and the comments that you're getting back, I'd really like to know more about that so that we can have this kind of feedback loop and we can find out really, like you discovered with your garage, Jeff, what's really going on. So we need to just be a little bit more specific on some points. And I think that would help from an advocacy standpoint.
Vern, if I may, those of you who don't know, Michelle sits on the, task force committee group of folks on the Colorado side who help to form some of these guidelines. And we are beyond we're beyond fortunate to have her with us. It's like gold. So thank you.
Thank you. It's at the national level, actually, on the drafting committee for FGI.
That's even.
But I'm a fish out of the water because I'm a lawyer trying to play an architect in some groups. So any help that I can get on that would be very, very welcome.
You did so well. You did great, and
Thank
you're doing
you.
great.
Thanks.
And thank you for your tremendous work.
My pleasure.
Tamara?
I have nothing more to say.
Okay, I thought you were trying to raise your hand. I'm done, Vern. I'm sorry.
Okay, terrific. Thank you so
Nice to meet
much.
all of you.
So this is the part of our meeting that we go to haves and wants. And this is an opportunity if you have a service or if you have something that you want to share with the group, or if there's something that you need from the group, this is an opportunity to do that. And does anybody, you can raise your hand or you can, at this point, you can unmute yourself. Does anybody have or what they would like to share with the group? Shelby, I thought you might jump in.
Hey, Vern?
Yes.
Sorry, one more quick question. Did you say there's a way to get a transcript of what's in the chat box?
Correct. So and I'll take this moment to remind everybody to put your contact information in the chat. Where you type your message, you'll see a little button with 3 dots. If you click on that button, you should have a save chat option, and that will save it as a text file.
Vern, unfortunately, my husband and I have been trying to find those 3 little buttons, and we're not finding it anywhere, at least on our chat.
And there is no save option as well.
No, I have no 3 dots anywhere on this thing.
It doesn't work on a phone. You
No,
got to be on the desktop version.
I'm on a laptop.
Well, it's right next to,
It's
where
so
you type your
faint you can
message
barely
down
see
below.
it.
Can you get it and post it on your meetup group, Vern?
Yeah, I could probably do that. I could, when we put this on the website, I could put a link to the text file.
That would be appreciated. Thank you.
Yeah, or if you need it too, you can always email me and I can just send it to you directly.
Oh, okay.
So Zoom, if you want to do that.
Okay. Okay, yeah, we're not finding it, so we'll do that.
Okay.
So
Yeah,
in the meantime, are we supposed to buy masks from Dennis on Amazon right now? Is that what we're supposed
yeah.
to do?
I was trying to share where those 3 buttons were. Right.
I love that. I love that. I need to know where to buy masks.
Well, here, as an FYI, everybody check with their local city. I don't know how to get out of this now. I'm located in the city of North Glen, and I have until Friday to come up with $5,000 worth of receipts of money I have spent on COVID, and they're going to reimburse me.
Wow.
So I'm buying masks by the case right now.
Good for you.
Okay, haves and wants.
Excellent.
Brian, did you raise your hand?
I'm raising my hands to say it was lovely, intense conversation. It's really good to see the coordination. I'm signing out for now, and I'll catch up with a few of you later on next week.
All right.
Bye,
Terrific.
Brian.
Bye-bye.
Glad you could join us. Shelby, do you have a have you want to share with the group?
I would just like to say hi. It's been a while since I've been with this group. It was back in the spring, I think, last time I attended. I'm Shelby, and I'm with Good Day Pharmacy. We're a long-term care pharmacy that services the entire state of Colorado. And I would love to visit with any of you if you have any pharmacy needs.
Terrific. Thank you, Shelby. Anybody else have or want?
This is Maggie.
Hi, Maggie.
Hi there. So I have speaking of masks on the screen, I've been struggling to buy good quality masks. Does anybody have any good contacts at reasonable prices?
Dennis, you
Well,
have some for sale?
On my search on Amazon right now, I'm finding a lot of stuff. When you say good quality masks, are you looking for disposable?
Yes.
You have to upgrade to like a KN95.
But even some of those that I've gotten have really been such a poor quality.
Really?
Yeah, I've been trying to get the state to do a state stockpile.
Yeah,
where
that
they-
ain't happening.
And yeah, I've talked to, I don't know, at least a dozen people and nobody's going to do it. So of course that would help us. So that's part of the reason why.
I got some up here in Fort Collins from I'm guessing it's state supported or county supported. I just asked and they gave me like 500 of them.
For free?
Mm-hmm.
Wow.
Yeah, what county are you in, Maggie?
Denver. They are not giving them out in Denver.
Yeah, because I'm in Adams County and they did the same thing with us. They delivered just in the beginning. You know.
Yeah, in the beginning they did with us.
Yeah.
But they stopped that in probably June.
Yeah, I would say so.
I just got mine like a month ago. I got sanitizer and gowns and the plastic cheesy gowns, but they're still gowns.
And that's Larimer County, Tamara?
Yeah, yeah.
I will check again with Denver County and tell them that they're still giving them out up in Larimer. So why is that?
Just say other counties, don't write us out.
Yeah. By the way, I just wanted to share that if you want to copy the text, you can do a control A, just be in this chat, do a control A, then a control C, and you can put it, go to your email and do a control P, and you can paste it in there.
Hey, Maggie.
Yeah.
This is Jennifer Conrad from Gardens Care. So I have a contact of a gal who's trying to, she bought an abundance of KN95 masks as well as gowns that she is selling at a highly discounted rate. Let me give you her name and number.
That
Would you
be
like for me to
great.
just put it in the chat?
Yeah, that would be wonderful, Jennifer. Thank you.
Okay, I'll add it to the chat for everybody to contact her.
All right. Thank you.
You're welcome.
Terrific. So I do have a have that I'll announce to the group. I have an assisted living for sale right now. It is in Centennial, licensed for 11 beds. Has 7 bedrooms that are private pay on the main level and 2 bedrooms that they do Medicaid, which could be shared Medicaid in the basement. And it's listed for $790, and ABW is willing to do the financing on this. So just wanted to put that out to you guys. If you have any interest in something in Little Centennial, or if you know anybody, then please reach out to me. Just again, going back to our screen, our group, when we are live, is $80 for individual annually and $120 for partners. As we're virtual right now, we have very, very little expenses, so we don't really charge anything at this point in time. Eventually, we're going to end up at Torchy's Tacos, but who knows when. We thought this might be happening in a few months, but you know, right now it could be 6 months or who knows, so we'll just continue to do this virtually as well as we can. And I hope everybody got something out of tonight. We will leave this open for the next 20 minutes so that if you want to network some more between yourselves, you're welcome to do that. And it gives you a little bit of time to download everything. So with that, I'm going to bid you adieu and sign off and leave the room open as we clean up and everything. And if you guys have anything that if you want to do some networking, go ahead. Catherine, you have a question? Catherine, I see your hand is raised. Yes?
Yeah, just now you said that 700. Yeah. So can you hear me?
Yes.
Okay. Just now you said that 790 that business is in at Centennial. How
Yes.
many license?
License for 11.
For 11. That is fully running operate.
Currently operating today with 9, but there's room for 2 more.
Yes.
So if you have any interest in it, just give me a call tomorrow. We can chat about it.
Then you said there is a finance offer, right? Available, right?
Right. ABW would do some financing with this. That would fit our program.
Thank you.
Okay. Thanks, everybody. Appreciate the turnout tonight. We had a great group. Jeff, thanks so much for everything that you did. The information you gave us was wonderful. Tamara, thanks for joining us as well. We look forward to working with CALA and helping the community and building this to be a little bit stronger as we move forward.
Thanks a lot, guys. Nice to see all you.
Thank you all for letting us join you today. Sure appreciate it.
Thank you, Jeff and Tamara and Michelle and all the others. It was very good.
Okay.
Thanks.
Hope everybody has a safe drive home.
I have a quick question for anyone who's left out there that has a small facility that may not offer health care for your staff. And if you are doing surveillance testing on your staff, how are you accomplishing that? And are you asking for all their actual insurance cards and putting it through on their insurance, if anyone has any information on that?
I have had baseline testing done through the state, and they were supposed to come back last week and do the surveillance testing, but because of all the outbreaks, they've been backed up, but they're paying for it. The state, we're not being billed for it at all.
Yeah, I think my problem with using this data is you get the results back in like 7 to 10 days. So
I got it back in 3 days.
Okay.
What is surveillance testing?
Just like baseline testing, constant testing.
I got it in 3 days, Heather.
Okay, so are you guys testing your staff weekly or every couple of weeks? Or?
Well, as I said, we did the baseline testing, then they were going to do it every other week, and they weren't able to come back last week. We haven't heard back from them because of all the outbreaks lately.
So I would just caution, be careful what you don't want to find. I think the surveillance testing is good, but make sure you have a plan to cope with that when you have those positives. We did baseline too, and then we haven't gone further yet.
We have a lot of our residents that leave the facility, and so I think I'm more comfortable knowing if they have COVID rather than just, they might be asymptomatic and they're spreading it throughout, and then I don't know.
Yeah.
So who's issuing these tests?
The rapid response team for the state lab.
I can send you information, Dennis.
That would be great because, I'm working with a couple labs, but I can't submit a test at all without an order from a doctor to get it paid for.
Yeah, that was our issue, Dennis also, is that we are working with a lab and we can get orders from everyone's doctors, but it's.
But you can't do it every week.
Yeah, I didn't need any orders at all for it.
Yeah, I definitely need some information on that.
Just sent it to you.
Okay, thank you.
Yeah, Tamara, if you can possibly just have Vern send that out to everyone.
Sure, we can do that. I'm going to sign off. Thanks, guys. See you next time.
Since there is still a few more people on there, I am struggling to find QMAPs. Does anybody have any suggestions? I was on a call today with the Direct Care Workforce Committee, and it was kind of a worthless call. It was all pie in the sky kind of stuff. I was hoping for more solid leads on where to go.
It's extremely difficult just to get employees. I mean, I had, I don't know, maybe 2 months ago, I had 60 interviews set up in a week, and I only had 2 people show up.
And Dennis, don't you find that you're almost hiring whoever shows up because
without
you
a
have
doubt,
to? Yeah.
Without a doubt, and to add QMAP on top of that,
Oh,
it's
yeah.
like, even, I've had an Indeed account, and
Yeah.
that's expensive to do.
It is.
And I'm so desperate to fill a position right now that I reactivated my Indeed account and put the money out there, and I got 11 applications. Only one of the phone numbers of those 11 applicants was valid. So I'm going to call Indeed and tell them I want my money back because,
And not only that, they're not qualified. We've had the exact
Exactly.
same issue.
These people are just, all they're doing is looking for my name and number so that they can say they're looking for a job and keep collecting the check.
Yep.
That's all
Absolutely.
That's what I found too, is no one wants to work because they're getting paid to sit at home.
Why would they? They're making more money and they're not risking their life.
So it's been very difficult to hire.
Hey guys, this is Audrey Krebs. I used to work, I retired from the state to go into assisted living. I was with Aging Services, but I also was the director of the Senior Community Service Employment Program. And I know I've been trying to help somebody, someone on here find. Can you hear me? I'm sorry. Okay. Anyway, if you guys, I could make some calls to different agencies. I think there's a lot of agencies that work with people with disabilities and people that are on the verge, if not homeless, and their training programs. And granted, you're saying, I mean, I can imagine what you're thinking. Well, we don't want anyone in our home that's homeless. However, they might be on the verge, or they might be living in their, they may be really good people that just had some hard times. And they would probably love to work. So if you want, go ahead.
I'm all about hiring people like that.
Okay.
If they can pass the background check,
you bet.
People on hard times, I get that, been there. So if they can pass the background check and they've got a decent work history, they're not sitting home just collecting government money,
Right.
come on, I'll train them.
I'll make, okay, so Dennis, so you guys send me an email. I'm going to give you my personal email, not my work email. It's AA Krebs. Oh, here, I'll put it in the chat.
Okay.
aakrebs@gmail.com. And text me or send me an email if you want to work, if you want some information. I'll make some calls. If I get some people saying, yeah, I want some information on who to contact, because I know I have a lot of people that I know in employment and, or that, work in that. Anyway, I'll find out where they're at with people and see if we can help find QMAPs. I know, because I worked in assisted living homes for the last few years, and I know how difficult it is. I do. But I don't believe that the people that could have been contacted were contacted. I don't believe they were. So, okay?
Thank you, Audrey.
Yeah, you're welcome. I'm going to shut my screen off.
Put your email in there.
I did.
Ready to sign out.
I did, but I don't see it. I put it in. Oh,
Up at the top.
no. I think I by accident sent it privately to someone. Here. There. Is that it? No? Or maybe you guys got it. Maybe it is at the top. Let's see. No, it's not there. So it's AA Krebs, Krebs, aakrebs@gmail.com. I am right here. I am in, I'm with agingservicesconsultants.com. That's my business, Aging Services Consultants. So, but it's aakrebs@gmail.com. Okay?
Thank you.
You're welcome.
We're done. Thank you so much. This has been extremely helpful.
Yeah. Bye, everyone. Have a good night.
Thank you. You too.
Leave the meeting.